Let's close the window to my escape hatch. You laugh, but you know when you do preparedness.
Oh, yeah.
I already figured out that window is super easy to get out of. Got a closer to the ground, too.
Oh, okay, good. It's good. This must be the group meeting that started. Yeah. So
All right. Camera's on and everyone's here, so we will call the Public Health and Human Services Board to order on Tuesday, April 16th. We have one addition to the agenda, which is the proclamation for Mental Health Awareness Month. Otherwise, could I get a motion to approve the agenda?
So move.
Second.
All in favor?
Aye.
Excellent. And then does anyone want to pull anything out of the consent agenda? Otherwise, can I get a motion to approve the consent agenda?
So move.
Second.
All in favor?
Aye.
All right, before we go into staff report, I would like to read the proclamation. Whereas mental health is essential to everyone's overall health and well-being, and whereas all Americans experience times of difficulty and stress in their lives, and whereas prevention is an effective way to reduce the burden of mental health conditions, and whereas 1 in 4 adults experience mental health problems in any given year, and such problems can contribute to the onset of mental illness. And whereas long delays, sometimes decades, often occur between the time symptoms first appear and when individuals get help, and whereas with effective treatment, those individuals with mental health and other chronic health conditions can recover and lead full, productive lives. And whereas each business, school, government agency, healthcare provider, organization, and citizen share the burden of mental health problems and has a responsibility to promote mental wellness and support prevention efforts. Therefore, I, Heidi Dukirk, Cook County Public Health and Human Service Board Chair, do hereby proclaim May 2019 as Mental Health Awareness Month in Cook County to increase public understanding in the importance of mental health and to promote identification and treatment of mental illness. It's always nice when we get to do things that help promote health and wellness in our community. I guess sums up the work of public health, doesn't it? So now we will move into our staff report, care coordination for persons with disabilities.
Good morning.
Good morning.
Hi.
I'm Martina Johnson. I'm the Adult and Home and Community-Based Services Supervisor.
I'm Lynn Wright, and I'm one of the 2 care coordinators. Well, I guess there's 4 of us? How many? 3. I'm one of them.
We just had Olivia Bonander start with us a few weeks ago, and so that's why Lynn kind of wasn't sure about that. She has decided and agreed to take on some of our care coordination as well. So now we have 3 care coordinators. So we are going to present today on care coordination, which is a huge part of Lynn's work, and also Diana White is our other social worker who primarily does care coordination for our agency. Cook County Public Health and Human Services is one of many county health and human services agencies across the state that contracts with managed care companies to provide care coordination for persons with disabilities and individuals age 65 and older. The following plans, which are administered by the Minnesota Department of Health and Human Services, or DHS, and the Centers for Medicare and Medicaid Services, CMS, offer care coordination as a benefit. Minnesota Senior Health Options, or MSHO, Minnesota Senior Care Plus, MSC Plus, and Special Needs Basic Care, SNBC. We use a lot of acronyms, so I apologize, but as we go through, the acronym will be associated with the actual title. Cook County PHHS currently contracts with Blue Cross Blue Shield, Health Partners, and UCare to provide care coordination to roughly 75 residents of Cook County. So
You said 75?
75.
Okay.
So the first managed care plan and our primary plan that we have the most clients taking part in is Minnesota Senior Health Options, or MSHO. And that's a plan for individuals 65 and older who have both Medicare Part A and B and medical assistance. When a person enrolls in MSHO, all of their health insurance benefits are combined into one package. So their Medicare, their medical assistance, and their prescription drug plan is all in one package. It's all on one card that they can use when they go to see their doctor. There's no monthly premium, but they might have co-pays for certain healthcare services. Minnesota Senior Care Plus is probably our least utilized plan. There's just a small amount of people that use this plan because it just doesn't have the same benefits as the MSHO plan. It's for individuals age 65 and older who have medical assistance. It does not roll a recipient's Medicare and prescription drug benefits into one plan. And like MSHO, there's no monthly premium, but members may pay a copay for certain health services. So sometimes we have members who enroll in Minnesota Senior Care Plus, and the health plans that we contract with really encourage us to talk with members about going into MSHO, Minnesota Senior Health Options, because it's a better plan. There's more benefits to it. So then for our individuals who are 18 to 64, we have Special Needs Basic Care, and it's a voluntary managed care program for individuals who are certified blind or disabled by the Social Security Administration or the State Medical Review Team. And this is a great plan for people who are in this age group who are on medical assistance who are certified disabled, because they do not have any co-pays for their MA covered services, prescriptions, and over-the-counter drugs. And there are no health plan premiums, deductibles, or co-pays. Currently, our agency has contracts with Blue Cross Blue Shield to provide MSHO, Minnesota Senior Health Options, and MSC Plus care coordination. And we provide those two care coordination for those two plans for people that live in the nursing home, people that live in the community and are considered community well. They're not on a waiver. They might have services, but they're figuring out other ways to pay for those services. They might have lower needs. And then we also help individuals who are on the elderly waiver. So that might be people with higher needs that need more services in place to help them stay in their home. So for Blue Cross Blue Shield, we provide care coordination for those two plans, MSHO and MSC Plus. For Health Partners, we just provide care coordination for SNBC, so that under that 18 to 64 population. And for UCare, we provide care coordination to MSHO, MSC Plus, and Special Needs Basic Care. And once again, that's for people that live in the nursing home, community well members, and EW members. This is just a snapshot of our current caseload. I just looked at the numbers yesterday. So currently for Blue Cross Blue Shield, we have 17 members that live in the care center. 15 of those are on the MSHO program, and 2 of those are on MSC Plus. Currently, we have 21 community well members, so people that are living in the community that have lower needs, that are just getting services informally or paying other ways, not quite at the waiver level yet. We have 21 of those individuals. 19 are on MSHO and 2 are on MSC Plus. And we have 9 elderly waiver members, and those are all on MSHO. For Health Partners, our numbers have dwindled. Seems like people who want to enroll in SNBC tend to choose UCare. For whatever reason, it might just be name recognition, but we only have 2 members currently under Health Partners. UCare, we have 4 individuals who are living at the care center. 3 of those individuals are on MSHO, 1 is on MSC Plus. We have 11 community well members, so 10 of those individuals are on MSHO, 1 on MSC Plus. 1 elderly waiver member, and 8 SNBC members. Care coordination, it's a really important service. Like I said, we have 2 people currently that are licensed social workers that are Their primary role is to provide care coordination. We just had Olivia Bonander start, and she is also a licensed social worker. She took over for Jean Munson, and she is also has just recently taken on some of our SNBC clients. Care coordinators follow the specifications of each managed care contract to reach out to all newly enrolled members. So when someone enrolls in a health plan, we are required by each plan to reach out to them within a certain number of days, usually 10 days. We reach out and say hello, introduce ourselves, welcome them to the plan, and let them know of the benefits of being enrolled in the plan. If an individual is interested in working with us, they always get the choice. They don't have to engage in care coordination. Some people choose to opt out of it. But if they are interested in meeting a care coordinator, the care coordinator would go out and perform an assessment of the individual's health and safety needs, and then develop a personalized care plan that identifies formal and informal supports, health needs, and goals. And then the care coordinator on that care plan would designate how often they're going to be following through with the individual. So it might be once a month if a person has higher needs. It might be every 3 months, every 6 months, but it's at least a minimum of every 6 months. The care coordinator will remain in contact with each member as delegated by the health plan and provide assistance ongoing as needed. So it's like a social worker. The care coordinator is an individual's social worker, but also guiding them through the ins and outs of their health plan. There are quite a few benefits and services of being enrolled in a managed care plan. I just listed a few here. Eligible recipients receive a variety of benefits and services, and these may include the following: care coordination, dental care, doctor's visits, durable medical equipment, emergency room care, gym membership, which is a great benefit that lots of people take advantage of. Home and community-based services, which would be all of those services that come into the home, like in-home support, Meals on Wheels, personal emergency response systems, home care nursing, home health services, online health coaching, prescription drug coverage. I also skipped over hospital care, labs and x-rays, prescription drug coverage, support for tobacco cessation, and transportation coverage to and from medical, dental, and mental health appointments. So there's quite a lot of benefits of being enrolled in these plans. And now Lynn is going to just talk about some situations that he's had with clients where just it's been a benefit for a care coordinator to be involved in that person's life. We might not have otherwise been connected with that person. They might not have sought help on their own. And so he's just going to share a few stories.
Sure. I'm currently assisting a woman who recently moved into her own apartment. And I want to make a clarification as well that there is not only is it a voluntary on the part of all of the members to have the care coordination, they can choose to meet at our office. They can choose to have us come out to their homes. It's really up to them, and so I really like to keep that at the forefront, that all of that is self-directed by the members. The woman in question we've been working with for some time, helping her transition from living with her family to an apartment on her own after being on a wait list. Trying to get into some of the subsidized elder housing takes quite a while. She was on the list for 9 months and was able to finally move in. The programs are all need-based, and so it's not necessarily disabled people that would do that. It's going to be part of the medical assistance eligibility, so it's going to be income-based. And again, once people are 65, then, and if they are reduced below a certain income, then they're going to be eligible for the managed care programs themselves. If they're eligible for medical assistance, they're automatically moved over to one of the managed care programs. So. And that will include a whole array, as Martina talked about, of services. So I helped this particular woman help fill out the applications for all the programs in town. There's a number of complicating factors that have arisen in helping her and her family work through those so that she can remain eligible for medical assistance and thus continue receiving the MSHO program. We're going to be working on opening her under what's the elderly waiver that Martina had alluded to, which will help her with in-home support worker for cleaning. She's mobility impaired, and so she does need a array of services to help her, you know, just for shopping, getting her out, getting her prescriptions. I mean, the whole gamut of services that would be important for her. So that's one example. There's another example of a gentleman that I had been recently working with, and you know, the self-directedness is really important. The doctors and the social workers, care coordinators involved have been trying to get him into the doctor for a period of time because he's been having a lot of arrhythmia in his heart, and his heart will beat as high as 150 beats a minute, and he's 85, and that's usually not a good sign. He finally succumbed to feeling pretty crappy one day when I just happened along over at the apartment building where he lives and recognized that he was in distress, and he agreed to go into the doctor. And so it's been a bit of a journey for him, but you know, they get to make those choices, and he's competent to make those choices, and continuing to try and help him see the wisdom of getting down to the cardiologist in Duluth. Still working on that one, but we're hopeful that that will come about soon. There are times when folks kind of are unable to continue living on their own, and another example is a gentleman that we helped move to an assisted living in Duluth. Learned a lot about the assisted living programs. They're all very different that they have down in Duluth. There's many of them. Many of them are income-based. Some of them are completely private pay, and so there's a whole array of the different needs that somebody might have for those as well. But that was a slow process, not wanting to push too hard on anybody that would feel like, oh, you know, you're trying to just, you know, put me away or whatever. You get a lot of that from our elders. They worry that, you know, some are willing to go because they, you know, all the food and everything is going to be provided for them, and others are just stubbornly independent. And so we work with them as best we can where they're at, and say, hey, let's just go look at it. You can ask questions. There's nothing that's forcing you to go into any of these places. So those are some of the brief examples. I think, like Martina had mentioned, we wear two hats. I think the social work hat and the care coordination hat, and a variety of others that just kind of might come into play. You never know what you're going to walk into when you're visiting with people. So
The last example that Len mentioned, I was just really, his work on that was just very admirable. One of the values of the social work profession is self-determination, and he really allowed that man to choose where he wanted to live. And it took months. Lynn took him down to Duluth on at least three occasions, and took the time with that person to show him different places and really let him choose where he wanted to be. And he didn't move in right away. It was after a few months, and after a point where it was difficult for him to make decisions, and we already knew what he wanted, so we were able to honor where he wanted to be, and that was just really admirable. And Lynn does great work, so just wanted to say that.
I learned how to make international phone calls. I've never done that before.
Any questions for us?
Ginny? Yes, thank you. With the amount of residents, 75 residents in the county, has that risen in the last 2 or 3 years, and are you prepared for more because of all of us getting older?
It feels pretty steady. It feels, I haven't looked at the numbers. Unfortunately, as we gain people, we lose people, just naturally, through natural causes and whatnot. But it feels like our caseloads have grown. It used to be where we would go months without receiving new members, and it's pretty often that we get a new member for one of the health plans every month. So I don't have an exact answer to that question, but it feels that way to us, that it's growing.
That it's growing, and you feel you'll be ready?
I think so,
Okay.
yeah.
Not that I have anybody lined up, but. And it covers, folks with disability too, I understand that.
Yes.
In that age group too. As I look around the county, and I'm on the ARDC Commission Board, the senior linkage. Also, in the Arrowhead area is very aware of how they can reach out to people too, and they're working on all of that. And we appreciate, their work with us in Cook County with Care Partners and that sort of thing. But I know they're realizing too that this area is aging, and how can they help you and help all of us to make the best plans for our future. And a lot of times that's hard. Sometimes families have to step in. You've probably seen that too. And then it becomes maybe a little tug of war of, I want to do this, and they say, I think you should do that. And so it's a lot of psychological things that you have to work with. Yeah.
Jerry?
Lynn, let's say you had, I don't know if it'd be this elderly gentleman or someone else that needed trips to Duluth for, say, treatment in a series of trips. What would your role be in helping them find a way to do that, and what are the resources you might turn to get that done?
Well, we oftentimes, we arrange transportation all the time for folks that need to go down to Duluth for specialized services, because we don't have it up here. Depending upon the client, if they are able and willing to go down with one of the transportation providers and take care of their own business, then by all means, they need to do that. And I'm always willing, depending upon the circumstances, to actually make the transportation and do the trip with them as needed. So it's just varies greatly on what the needs are and the individual, and how independent they can be, and kind of what is the circumstances that we're sending them down for. So I hope that answers the question. Okay.
Do you feel there's a gap in available transportation for things like that?
Well, I think we have two. Well, in my work with the care coordination and with Blue Cross Blue Shield and with UCare, we have to go through the process of arranging the transportation. And I think the bureaucracy involved with that is a bit of a headache at times. But at least it's a process that's there. So the in-home support, there's a number of our in-home support workers that are willing to provide transportation in addition to the work that they do as a homemaker or, senior companion or whatever. But then Arrowhead Transit is also a contracted entity that will make, and there's a number of people that are contracted through Arrowhead locally, and, Two Harbors or Silver Bay that will that make those transportation as well.
Myron?
Yes, Lynn and Martina, thanks so much for what you do. It's an essential part of our services to our people. You mentioned qualified housing and a waiting period that was necessary in that specific case. Could you just give us a summary from your perspective of what the housing situation is for these people? I assume they're HUD 55 and over units, that it's a federal requirement. So how many of those do we have? And I'm aware of some. And then if you have any kind of suggestions on what could be better.
Yeah. Well, I'm aware of 3 facilities that will work with elders: Harborview, Grand Marais Apartments, and Sawtooth Ridges.
It's the same.
And Birchwood.
Birchwood
Sorry,
for
Birchwood.
individuals who are, any individual who has
Any
lower
age.
income, yeah.
Housing is a difficult area for any people of any age in Cook County, as it has been discussed, repeatedly. All throughout the county, I think, is just very difficult. Solutions, I think the people are really aware, and I think that's the beginning. And I know there's a lot of interest in trying to figure out new ideas and new ways to house people. But I think that it's very difficult, the size of the county. Could we use 2 or 3 more, complexes? Probably, you know, there's that balance, you know, of trying to figure out the need and how many people would use that service. And there's a lot of folks that have moved out of county that have, you know, maybe living in an assisted living or something of that. That's a program I think that would be helpful, but I know that that's been addressed, and it's difficult to try and find that balance again for the number of people that we would have, and the services, and then staffing. All of those things are challenging. So, Martina, I don't know if you have other thoughts.
Yeah, I was just going to say, when Hillhaven closed down, that was a loss for us. We have people that have had to move out of the county, like Lynn said, to find an assisted living, or people who need that level of care. And then the care center is wonderful. They have a very long waiting list. So we're kind of running out of options locally for people.
Thank you.
Carla?
I just wondered, when you went down and looked at assisted living facilities, I assume in the Duluth, Two Harbors, kind of Silver Bay, whatever area, Lynn, did you find there were adequate programs for people to choose from? Is there a shortage there? Is there long waiting lists?
Depending upon what an individual is looking for, in the folks that I have referred down have been able to find something. It may not be exactly what they had hoped for, but usually there's going to be an opening in one of them. There's a number of facilities in Duluth, and again, it's just that matching, that they're going to feel comfortable, that they feel like that's what they were hoping for, a homey environment versus, you know, more of a structured type of a place. And depending upon the needs, some folks will see themselves as more independent. And, you know, when I took somebody down to the Silver Bay assisted living program at Carefree Living, the first thing that they noticed was the balloons, you know, volleyball that they'll play oftentimes, and this individual was going, no, this is not for me. I don't need that kind of care, whereas everybody else that I could talk to and relate to, and so he was very unfortunate. He didn't like that idea. Even though there were a number of other individuals, he just didn't get to meet them that were more independent like himself.
Right.
So, yeah, but yeah, it's visually it's what people see, and again, just kind of matching those needs.
So right now, there's not a crisis with a shortage of places in those areas.
Yeah, I think it
Okay.
you know, depending upon the need, I've been able to, like I said, find place for folks. They may have wanted to stay in the community, and of course that wasn't
Right,
possible.
right.
You know, that's the hard part.
Right, of course.
Yeah.
Okay, thank you.
Any other questions?
Yes, thank you. Under the benefits and services, gym membership, what does that mean?
Under the M-Show program, basically the Silver Sneakers is called, and I can't remember the name of the other one, Blue Cross Blue Shield and UCare both have, basically we just take the folks over to the Y, and with that the card they'll be able to get a free gym membership and go. The other alternative that Blue Cross Blue Shield offers is like home-based. Somebody, they will send them out supplies and videos for Tai Chi or yoga or any of that kind of thing. So there's a choice of that if they don't want to do it like in a group. Yeah,
Okay.
they have that option.
Great, thank you.
I think it's Silver Sneakers for both.
Is it?
Yeah.
Okay. All right, couldn't remember. And they offer transportation as well, so like we'll give them a bus pass or whatever, but it's free transportation for folks to get back and forth. So,
That's great.
That's great that we have that opportunity for them then to join classes there.
yeah, yeah.
Thank you.
Thank you very much for your presentation.
Thank you.
Thank you.
Thanks, Lynn, for the custom service of also including transportation, willingness to give your time for that. I'm sure that means a lot to them to have the same person with them.
Yeah, yeah, yeah. Thank you.
Thank you.
Thank you. All right, Allison, Director's Report.
Just want to echo my appreciation for Martina and Lynn for your great presentation today. Thank you for the information and for telling us what you can about the stories, about the people you serve as well. So thank you. A few brief staff updates. As Martina mentioned, we welcomed back Olivia Bonander, formerly Olivia McGee, at the end of March as a member of the Adult and Home and Community-Based Services team, serving primarily adults and individuals with disabilities. I also want to take a moment to recognize social worker James Zimmer, who recently received his social work license and is now a licensed graduate social worker. James is the second social worker to achieve this within the last few months. Diana White is also a master's level social worker who received her license and is a member of the Adult and Home and Community-Based Services team. So a lot of the managed care plans that we work with serving elders and people with disabilities require this level of certification. But it's always great to see staff pursuing that certification and improving their skills and service. So thank you to Diana and James. Few agency updates. We met on April 9th with the Community Health Assessment Stakeholder Group. We are at the phase where we're moving from assessment into solutions within our identified priority areas. Just to reiterate what those are, they are access to behavioral health services, access to specialty healthcare services, supporting families with young children, access to safe, stable housing, recovery supports for people with substance use disorder, and supporting elders to age in our community. Grace Grenager, our public health coordinator, is currently developing a report on this year-and-a-half process of the community health assessment planning, how we gather data through survey, through meetings with community stakeholders, as well as talking about the outcomes of this process, how that information will be used. We'll be reconvening the group in 2 to 3 months to review a draft of that report and get additional feedback. We also talked about bringing that report to a future board meeting so that you can see more in depth what that process has looked like, some of the information that we've gathered, how we've arrived at those priority areas, and how that information will be used going forward. We also talked about making that report available to some of our partner organizations who are doing this work in the community so that they can also use that to leverage their work through requesting funds or additional resources. May is Mental Health Awareness Month in Cook County. Thank you, Commissioner, for reading that proclamation this morning. That's a kickoff to some of the work that we'll be doing next month to really elevate the work that we're doing with partners around mental health in the community. A few training opportunities that are on the horizon. On April 25th, Tina Nelson, who is the Northeast Minnesota Suicide Prevention Coordinator, will be providing a training at Higher Ed. That's on April 25th, 5:30 to 7, and that's the Question, Persuade, and Refer training, QPR, which follows that CPR model to really build muscle memory in learning the signs of and helping to prevent suicide. Also on April 26th and 27th, as a part of the Cook County Emergency Services Conference, there will be a Safe Talk alertness training as well that's offered. Under items for board action, we are requesting approval of the bylaws for a new committee on adult and children's mental health. That will be a committee that will report to this board. We are hosting an open house on May 1st at the community center, and you should all have copies of that flyer. So we're really working to promote this as a way for people to learn more about this committee, how they can be involved in providing input on mental health services and the future of mental health service delivery in Cook County. Also, under items for board action, we are requesting approval to add a new position to the PHHS staff using funds that were previously allocated to the Human Development Center to provide these community support services. In your board materials, we shared a draft position description, which will be going to the Personnel Committee this afternoon. We also have shared a copy of the budget that we have estimated for this position, how those funds would be reallocated from a purchase of service contract to this position. And then a narrative proposal which I usually like to avoid this, but I'm actually going to read it to you because I think it captures the history, how we got to this point, and why we're proposing this. I've also asked Grace Bouchard to join this morning. She would be the direct supervisor of this position and can provide a greater depth of information on why we're proposing this at this point. So previously, we had framed this up as a contract position that we would be looking at hiring an independent contractor to provide these community support services, similar to the model that we have with Greg Barnier, our licensed drug and alcohol counselor. After reviewing the statute, after consulting with our county attorney, after speaking with interested providers, really found that the stability, the oversight, the integration provided by a county employee would be the best path forward for this position. That when Greg, and this is something we just learned actually, that when Greg began providing services, he took over the contract that Harry Swift had previously as a chemical dependency counselor, and that contract had been in place for many years before Greg moved into that position. And there's some unknowns with this service in terms of growing how we'll be providing the service and looking at certification, potentially to bring additional revenue for the adult rehabilitative mental health services as well. So by having this person a member of the team, really think that that's going to be the best for stability going forward, most importantly for the people who would be served by this program. So our proposal is just a summary of the history of mental health services and how resources have been allocated to counties in the state of Minnesota. Over the last 20 years, the state of Minnesota has allocated funds and directed policies to support community-based mental health recovery. With the closure of the Human Development Center, the local community mental health service provider, Cook County citizens have lost access to a wide range of resources that support health and recovery. One of the service gaps created by the closure of HDC is a loss of community support services. Community support services are services for individuals who have a level of need that does not meet criteria or eligibility for reimbursement through medical assistance. Cook County PHHS has identified no less than 30 individuals locally who could benefit from this community-based mental health support service. These individuals have a high level of need that could be met by a community support provider. This position would have the potential to serve approximately 15 individuals. Again, these are estimates. Services provided may include community outreach and a range of life and social skills such as interpersonal communication, community resource utilization and integration, budgeting, shopping, cooking, nutrition, symptom management, household management, and employment-related skills. Other potential services which may be provided include community intervention, strategies that are provided to alleviate or reduce a recipient's barriers to community integration or independent living. These strategies can also help minimize the risk of hospitalization or placement in a more restrictive living arrangement. Transitioning to community living, which could include facilitating discharge from a hospital, residential treatment program, nursing home, or board and lodge facility between the rehabilitation service provider and the client. Cook County PHHS is proposing to hire a county employee to provide these services under the direction and supervision of Cook County PHHS for 40 hours a week for a minimum of 2 years. This will allow Cook County PHHS time to work with community and regional partners to identify a long-term solution to meet community mental health needs. The position will be funded utilizing grant dollars allocated from the Minnesota Department of Human Services, DHS, to provide this service. Historically, these grant funds were allocated to HDC and supplemented with county levy dollars to provide community support services along with other mental health services. PHHS is still in a planning phase. We're working collaboratively across organizations to evaluate needs with local medical and service providers. PHHS alone does not have the capacity to recreate the array of services that were provided through HDC and Cook County. However, where we identified the biggest gap and the greatest opportunity to address unmet needs at this time is reallocating funds to create this position and provide stability to residents in need of supportive mental health services. These services are restorative, recovery-oriented interventions provided directly to individuals, either in their homes or in the community. Access to behavioral health services and resources is an identified priority for our Community Health Improvement Plan, and we're in the process of forming a local advisory council for adult and mental health services, which will be another opportunity to engage more deeply with people and with the agency and board to help inform future planning in addressing behavioral health needs. So I've also, as I said, included the budget as an attachment that shows how those funds would be reallocated. These funds are allocated every 2 years and guaranteed through 2020 at the amount as described in the budget here. So the revenue from DHS, CSP, and Moose Lake grants, that's that $71,040 that we've received for the last 4 years, and that is the amount that's allocated for 2020 as well. And as I said, we'll bring the position description to the Personnel Committee this afternoon. The budget is based on our assumption of how that position would be scored. But as you can see, there are, even after adding this position, there remain unallocated funds to support mental health services in Cook County. I'll take any questions that you have for either Grace or I about this proposal or anything else in my report today.
Where are you going to put this person?
It's a really good question.
I know it's not a huge priority for the position, but really.
It's a very practical consideration for our office right now. We have a space in the front office that could be used temporarily. It's not ideal. We have 4 staff in our front office right now. We have the ability to have 5. It is not ideal having that many staff in one space, especially one that's so open, and staff that are providing a lot of direct customer service.
Well, I'm guessing that people using this service are going to want privacy.
Yes, and as I described, this would be a lot of community-based service. This individual will be in the field quite a bit, but would also need the ability to make phone calls, and just be able to concentrate on their work. So we're looking at the potential of reconfiguring one of our largest offices. It used to be Grace's office. She had it all to herself, and we've had a few moves since then. Now there are 2 staff in there, 2 mental health case managers, James Zimmer, adult mental health case manager, and Jade Waltman, who is the children's mental health case manager, share that space. It's also frequently used as a meeting space for the children's team because it is a larger space. They have a big table in there, and they use that for team meetings as well as meetings with families. And the furniture in there is really large. A lot of our furniture is quite large, like this. So we're looking at how can we use that space more efficiently, maybe reconfigure that with smaller furniture to make that a workable space for 3, because again, this position would really be integrated within that team of mental health case managers in working with the clients that they serve.
Myron?
Thank you. What is Plan B if you can't get someone that's qualified? Or is it highly likely you will get a qualified person?
I think that the way we have this position framed up and the requirements, as you probably know, we work with the Minnesota Merit System and Public Health and Human Services Department. It's a state department that provides oversight and support for some of our human resources work. And they have kind of boilerplate position descriptions that we borrowed from slightly in writing this position description. And we think that that there are people who could meet the requirements of this position. It's a bachelor's level position or someone with a certain number of hours of supervised experience. And we know, just based on conversations that Grace has had, that there are people in the community who would be interested
good,
in this position. But of course, it'll go through, working with the Minnesota Merit System, it will be posted and advertised and go through that process as well.
So they don't have to find housing, maybe.
There's 2 houses available for them.
It's always a factor, but, yeah.
And this is kind of Plan D already, right? I mean, HDC was kind of Plan A, and then they left, and then hoping maybe someone could move in. That was kind of Plan B, and then, so it has, just keep on trying, whatever. And this, I really applaud this plan. It seems like a really good way to go.
Jerry, do you have something?
I was going to say that when I was at HDC, we had at least 2 CSP, or some combination of CSP and ARMS workers, but 2 or 2.5 FTEs. There were 2 of us who were therapists, and then we had Dr. Bauer as there on a limited basis as a psychiatrist. And if you're working with people with serious and persistent mental illness, like schizophrenia or bipolar disorder, you've got to have a treatment team that's made of all 3 of these modalities. Sure, they see the psychiatrist once a month, maybe at most, and they're on the right meds. They see a therapist maybe once a week for an hour. The CSP worker's the hands-on person who is out there with them, whether it's guiding them toward handling life situations differently, whether it's crisis intervention, if something comes up and they need somebody to come over to their place and help them through a situation, or give them various kinds of support or transportation to services. The flexibility and the amount of time and attention that the CSP worker could provide often made the crucial difference as to whether that person was going to decompensate and need hospital or some other kind of care, versus hanging in there, getting through the crisis and staying in the community. So it's a very important position, and I think with HDC not doing it, we have to pick this ball up.
Myron?
I'm getting in the weeds here, and I apologize for that, but, we're short of space, office space. HDC, has that been leased by some other organization? Where I'm going is that available for lease for the county if we need to find space?
That's a really good question, and one I don't have the answer to. I believe that building is for sale right now.
Okay.
Jenny?
Yes. The budget looking like the 71,000 coming in for the next 2 years, this is a 2-year position, you said?
Yes, so it would be at least 2 years, grant-funded position. So we would be reevaluating the impact of that on the PHHS budget going forward. We don't have any indication that this funding source will end or decrease. As you can see in the budget, it's been stable for the last 5 years. But that, again, is an important piece of recruiting, just being transparent that this is a grant-funded position and something that would be up for evaluation going forward.
Right, so you then would have to make up the difference, or would you be totally funded?
I'm not sure what you...
Well, you have for 2019, the 71,000, 71 for 2020. Is there any difference that your department would have to make up?
Yes, so that's the line item underneath where it says PHHS department expense for HDC contract. That's showing what was coming out of the PHHS budget to support that $161,000 contract.
Okay.
And then towards the bottom, the impact for this position on the PHHS department budget is $20,453, but that's already allocated to mental health services in the 2019 budget. So just below that, that $110,000 is what remains unallocated from the PHHS budget for mental health services. That number hasn't been determined yet for 2020.
Okay.
Does that answer your question?
Thank you.
May I comment on future funding? So this.
Grace, do you mind just bumping up to the microphone, please? Thank you.
So regarding future funding, we're going to determine whether or not our agency can become licensed as what's called an adult mental health rehabilitative services provider. So that would allow us the opportunity to bill medical assistance for providing these services. So it gets kind of complex, weedy, but people who get CSP services either do not have a qualifying diagnosis or they do not have medical assistance. They may not have a qualifying diagnosis because they haven't felt comfortable or been able to get to a therapist to get that qualifying diagnosis. There's a lot of variables. And so the CSP designation is to get people to that spot, to the right spot, so that they can live independently. And Jerry described it really, really well, that it's a continuum of services and support. So if a person has a qualifying diagnosis and they also have medical assistance, then this kind of work becomes a billable opportunity and we can draw down funds through medical assistance. And so to become certified as an arms worker, we need to attend some trainings, but we also need to have somebody to sign off on the plans, and that level of licensure is a licensed independent social worker or a licensed therapist. And James Zimmer he has his LGSW, and he's commenced on his process to become a licensed independent social worker. So he would become qualified to sign off on plans which would allow MA billing. And that would be 2 years from now when he would have that licensure. And so that's the 2-year period that we're talking about is when we're going to gather all that information. James will proceed with his licensure, and then we'll know more, too, about what our capacity is and our abilities are and that kind of thing. So I really see the opportunity to draw down more dollars in this position so that it's a stable position, along with those grant funds that we're getting.
Mm-hmm. Well, it seems to me every time we turn around, mental health is just ripple in the water, and we're part of that ripple. It goes out worldwide. Oprah is now going to be working with Prince Harry. They're going to be doing a series for mental health rehabilitation, I don't know what it is, but they're going to be working on it. And we have a prime example of the little boy in Mall of America who was thrown over by somebody who has mental health issues. So it's whatever we can do in our small little space, become licensed. I don't know what it is, but we have our people to take care of, and then it just, like I say, ripples out to the whole wide world. So thank you for what you're doing right now, because it will make a difference in our area for sure.
Thank you. I know Allison and I were talking that we can't work on destigmatizing mental health services and then reduce the amount of available resources to people. So we have to, if we're going to destigmatize mental health, we also need to make sure that there's plenty of resources for people to resolve whatever stresses they have, and we all have them because we're all human. So, so thank you.
Mm-hmm.
I'd also like to mention under items for board action, we are requesting approval of a purchase of service agreement with the Sawtooth Mountain Clinic for clinical supervision of our case management staff. That was another critical role that the therapists at Human Development Center provided to PHHS staff in signing off on plans and providing supervision and consultation to those social work staff. So we have been working with the clinic and are just now bringing for your approval that addendum to our master contract with the Sawtooth Mountain Clinic to add to the many other services that they are providing on behalf of our agency. So that will be another piece of that overall budget as well for behavioral health services, is the contract with the clinic for their licensed clinical social workers to provide supervision. And we're meeting regularly with staff at the clinic, hospital, Grand Portage Health Services, and Human Services to talk about where the gaps are and how we can come together to address those needs, what capacity we have, and how we can do that. And we're looking at scheduling a time to bring together some of the staff as well, our case management staff and therapists, to do more in-depth planning work on where we see the greatest need.
Bobby?
So right now you're contracting this out, this work?
The community support work?
Yeah.
Right now, there is no one providing these services. It's falling back on our case management staff. In a lot of ways, our ARMS is being provided through Ascend services, but there's still unmet needs. Did that answer your question, Commissioner?
Well, I know someone that was contracting with HDC to do this out of Duluth, and wouldn't it be cheaper to find someone to contract with to do this service instead of creating another $90,000 a year job, having to provide an office space, so on and so forth?
That was our original direction with this position, was to look at a purchase of service agreement and a independent contractor. But again, after really diving into the position, the requirements, the oversight and integration with our staff, found that having the stability of a county position would be in the best interest, and that's how we're framing it up for you today.
I also think in that decision, the work is so highly directed by our staff that it really wouldn't be in line with a contractor. You know, that we would determine that individual's hours, we would determine who they would work with, we would determine what kind of work they would do, and so this level, that was the feedback that we got, that it just didn't really fit a contract position. Where like Greg has a contract position with Wilderness Outpatient, but he decides his hours. He is autonomous yet integrated. But this work requires so much integration because of how it's directed and guided. So.
Do we want to move into board action?
Unless there are other questions.
The first item for board action is the addendum to the clinical supervision. Can I get a motion?
So moved.
Second that.
And discussion? All in favor?
Aye.
Any opposed? Okay, the next item is the bylaws for the Cook County Local Advisory Council. Do you want to give an update on that?
Yes, so this is the council that we are recruiting for to get people who are interested in serving on this committee. Similar in structure to our Public Health and Human Services Advisory Committee, which provides advice on areas across the programs we work in, but this would be focused on adult and children's mental health. It's a statutory requirement that counties work with advisory councils that have a certain representation of people with lived mental health experience. And we found that we weren't meeting those requirements through our Public Health and Human Services Advisory Committee. So the bylaws were reviewed at an organizational meeting in March with Jerry and Carla, who are our Public Health and Human Services Advisory Chairs, as well as James, our Adult Mental Health Case Manager. Roger Linehan also sat on that organizational meeting as a representative from our Public Health and Human Services Advisory Committee. The bylaws were also reviewed by the Public Health and Human Services Advisory Committee at our last meeting. So this is just the last step in approving those bylaws and allowing us to move forward with the formation of that committee.
Okay, can I get a motion?
I'll move that.
I'll second.
Okay, discussion? All in favor?
Aye.
Any opposed? All right. Item C, approve hire of community support provider pending approval of the job description at the April Personnel Committee, which is today. Can I get a motion?
So move.
Second?
Discussion? All in favor?
Aye.
Aye.
Any opposed? Excellent. So we will move into committee reports. Arrowhead Economic Opportunity, Myron.
Dave Mills, thank you. You're the primary one on that. We got to get that changed.
Sorry.
That's all right.
It's right in the minutes.
Take it away, Dave.
No, that'll be tomorrow, so that's,
Okay.
yep. Stay tuned.
All right. Dave, you're also Arrowhead Health Alliance.
Yeah, nothing to report since our last meeting here.
Okay. Arrowhead Regional Corrections, Bobby?
We meet next week, but at last month's meeting, we discussed the bonding for the meat processing plant for NERC. They're going to try to get the rest of the money to complete that project.
Awesome. Arrowhead Regional Development Council, Ginny.
Nothing other than what I mentioned, Arrowhead Regional Development is working with Senior Linkage, and they're working on many different projects. And so later on, we'll hear more, have more of an update later.
Okay. Community Health Board.
It's upcoming.
Public Health and Human Service Advisory Committee, Carla and Jerry.
We did not have a regular meeting. Many of us attended the Community Health Improvement Stakeholders meeting, however. So that was, it's an important part of what we see as our responsibility in that committee. We'll have our next regular meeting in May, first Tuesday.
Excellent. Healthcare Planning Committee, Ginny.
We did not meet.
North Shore Collaborative, Dave.
Upcoming.
Emergency Preparedness.
We met. We met up at the Gunflint Ranger Station, and we had some interesting scenarios, like what would you do if, or what would be kind of your worst fear in Cook County? Mine wasn't the worst fear, but I said, I was thinking when we had the polar vortex and how that would affect older folks, and I was thinking about, people in my end, although it would affect everybody, but the seniors that I would know that might have trouble, I'm thinking, maybe I need to keep track of that and reach out to them if they need a place, and then figure out where we'd put them, probably a town hall or something. So it just gives you a chance to kind of think through scenarios, and then how would we all approach it, because it might affect all of us in some way or another. So it was a good meeting.
Excellent. The mental health info session, just a reminder for commissioners, if we're going to have a quorum, let's get that information to Jeff so it can get posted that there may be no decisions will be made there. It's a discussion, but just for transparency to make sure we post that there may be a quorum of commissioners. And then, does anyone have anything for the good of the order? It's not on the agenda, but. I think just all the work that we're doing and moving forward and getting this position set up is for the good of the order. One of the best things that we can do. It's not something we wanted to do, as Dave explained. It's plan D or F, but thank you for taking on the responsibility. Thank you for the considerations that the committee makes, and please thank your staff for being willing to have this flexibility. I know they already juggle a ton of things, and so now you're going to throw another ball in there for them to try and keep in the air. So, yeah, they're amazing. And hopefully no one will take that as a derogatory term, calling them jugglers. Carla.
Just quickly, could we get more of these so that we could take them to the east end and the west end?
Mm-hmm. Yeah, we should put those up.
Great.
Bullet points.
All right, so we will adjourn the public health meeting, and the committee of the whole will meet in about an hour. Thank you.
Thank you.
This is the name of the organization. And the guide to Duluth. And I thought this was excellent. And I think if you went on their website,
I guess that would.
yeah, you could get it free.
How to get it.